Dobra den. My name is Sali Pacholok, and I am the co-author of the book, Could It Be B12, An Epidemic of Misdiagnoses? I have been researching vitamin B12 deficiency for over 25 years, and I co-authored the book with Dr. Jefri Stюарт, who is a practicing board-certified emergency medicine physician, and we both practice in America. This is the cover of our book in America. Our book has been also translated in Dutch, Slovak, and recently picked up in other countries such as Italy, Germany, and Spain. B12 deficiency is the most commonly misunderstood, ignored, and costly nutritional disorder, causing cognitive decline, mental illness, poor health, neurologic injury, fall-related trauma, vascular occlusions, premature death, and obviously poor outcomes. Together, we can solve this epidemic by re-educating medical professionals and clinicians. The reason why we have a problem is physicians are not including the diagnosis of B12 deficiency in their differential diagnosis when they're working up patients. The signs and symptoms of B12 deficiency overlap other disorders. And we're not saying everybody has a B12 deficiency, but if you have signs and symptoms, the physician must test you to make sure that B12 deficiency is not the cause. The incidence of B12 deficiency is high because patients aren't being tested or treated. In America, low B12 or a deficiency is approximately 19%, as well as in the United Kingdom. In other countries, such as Latin America or Mexico, the incidence can be as high as 40%. In India, it can be as high as 70%, and in certain African countries, the incidence is 80%. There are several causes of B12 deficiency, from autoimmune disease, which is pernicious anemia, from certain medications, proton pump inhibitors, metformin, and from malabsorption syndrome, such as Crohn's disease or celiac disease. There are genetic mutations, certain diet, vegan, vegetarian, or patients who have eating disorders such as anorexia or bulimia. And there's other reasons such as H. pylori that can cause a B12 deficiency. So there are many factors, and this is why the incidence is so high. But we can turn this around by re-educating medical professionals and the public to the signs, symptoms, and risk factors. So through this book, you're going to learn through multiple case studies in published medical journals, as well as cases we've seen in the emergency department. Why we know there's such a problem is because working in the ER, we see a variety of patients that come in. And when we find B12 deficiency, when these patients have a primary care physician, they have multiple specialists, they're on all these medications, and they come in severely B12 deficient, that tells us that none of their healthcare providers ever contemplated the diagnosis of B12 deficiency. B12 deficiency is a very costly epidemic. So we need to re-educate the physicians and clinicians on the dangers and the consequences of untreated, undiagnosed, or misdiagnosed B12 deficiency. We could save millions, or billions actually, worldwide, billions of dollars, pounds, or euros, wherever you live. This is a worldwide problem. And it's not just America, but every country has a problem because there's such a deficit. So we want to work with all countries to prevent this and to get it on the radar screen so doctors are actively testing and treating patients. And vitamin B12 deficiency is very cheap to treat. And we also need to look for it in infants and children. In 2016, next month, we have a new book called Could It Be B12? And the pediatric edition, what every parent needs to know about B12 deficiency. So it's an easier, smaller text that it's updated for how we're injuring children. We look forward to seeing you in Bulgaria sometime in 2017, and maybe in the spring. And we are going to educate several universities and hopefully hospitals by giving a presentation and teaching them the updated version of B12 deficiency because there is a knowledge deficit, and we can solve this epidemic by re-educating clinicians. Also, there has been a film made about my 25-year journey and the problems I had trying to get this out there to the public, produced by Alyssa Leonard, titled Sali Pacholok, kind of on the lines of Aaron Brockovich. And in Bulgaria, this will be shown in Sofia. So I look very forward to meeting you all. And this has been a passion, my life work. And I hope to help your country and to save you from the insult of what B12 deficiency can do. Lastly, remember, we have to have B12 for a healthy brain, nervous system, and for the blood. So vitamin B12 deficiency attacks the brain and the nerves. So people can get neuropathy, which are numbness and tingling to their feet or hands. They get foggy thinking. They can develop symptoms where we think they have dementia. They can get depression, psychosis, suicidal ideations. So it's important to test any patient who has mental illness, any elderly person that we think is having dementia. And it also causes a gait and balance disorder because you have to have B12 for the nerves. So people can fall frequently. So we do see fall-related trauma. We can prevent hip fractures and other kind of fall-related injuries. Especially many patients are on blood thinners nowadays, where if you fall, you could have a brain bleed. So there's much more to learn about B12 deficiency, which we go through the book in detail, the different tests used to help diagnose B12 deficiency, the signs, the symptoms, even research projects, but we wrote it for lay people and physicians. It's easy for lay people to understand, but it's not too simple that physicians will be turned off. So it's a book for everyone. And we hope this book will be worldwide, and maybe one day we'll work with the World Health Organization to solve this epidemic. I want to thank Kibia Publishing for translating our book in Bulgarian. Our book will help educate Bulgarians to the consequences of untreated, undiagnosed, or misdiagnosed vitamin B12 deficiency. We look forward to coming to Bulgaria in the spring of 2017, and Dr. Maria Papazova, along with Kibia Publishing, are organizing several conferences to educate healthcare providers and the public about vitamin B12 deficiency. Thank you again, and do skoro!